Good afternoon. I'm Antonia Stanislas, and I'll be talking to you on ZikV. We're going to look at the background of the disease, transmission, symptoms, diagnosis, high-risk groups, prevention, and as well as case management. ZikV is caused by the Zika virus, a flavivirus caused by yellow fever, dengue, West Nile, and Japanese encephalitis virus. Zika virus is endemic to Africa and Asia and was first identified in April 1947 when fever was developed in a rhesus monkey in the Zika forest of Uganda, following some yellow fever research. In recent years, however, ZikV infection has been occurring outside its geographical region. In 2007, the first major outbreak was found in Yap Island, where 185 suspected cases were reported. In October 2013, 19,000 suspected in the South Pacific island of the French Polynesia. Actually, that was the largest outbreak that was recorded. In May 2015, Brazil confirmed its first case of ZikV. As a result, both Jamaica and Trinidad have begun implementing preventative strategies. This map shows countries with past and current evidence of Zika virus transmission, and this is as of May 2015. And as we see, that the virus definitely has been found outside of its endemic region. ZikV is a vector-borne disease. It's transmitted by the Aedes aegypti and Aedes polynesis mosquitoes that also transmit chikungunya and dengue. It is not contagious and so cannot be transmitted from person to person. ZikV is self-limiting. Symptoms appear 3 to 12 days after a bite and last for about 4 to 7 days. And these include severe fever, joint pain, headaches, rashes, conjunctivitis, and swelling of limbs. Although not as deadly as ZikV, ZikV can cause significant illness, and cold infections can occur with dengue. This was a case report from someone who was infected with ZikV. He reports having rash over his face, his neck, trunk, upper arms, and having transient fever. By the third day, he says that the rash disappears. And when inoculations were done, ZikV was isolated from the serum. Diagnostic tests for ZikV infection include PCR tests on acute phase serum samples to detect the viral RNA. Other tests can be used for specific antibodies against the ZikV in the serum. Although no one is exempt from mosquito bites, high-risk groups prone to ZikV are persons who are poor, living in unsanitary conditions, which are potential mosquito breeding sites. The very young, the elderly, who probably may be suffering from previous ailments, and persons who have compromised immunity. Prevention strategies include primary prevention so that the chain of transmission can be broken. First, let's look at the environment. Public awareness of transmission and prevention of ZikV infection must be made, and effective waste management system must be implemented. Persons must be able to cover and store water properly and change their water in fish tanks and vases. If we look at the host, fogging is an important factor that must be considered. And the use of sterile mosquitoes to control population numbers, mosquito populations, is also a viable option. Primary prevention strategies on the individual level involve the use of insect repellents and wearing appropriate clothing. Case management. There is no known antiviral treatment for the ZikV infection. Hospital care is only required when there's severe illness or some kind of complication. And treatment basically includes rest and use of painkillers to revive fever, relieve fever and pain, as well as antihistamine to control the itching. Patients are advised to continue drinking plenty of water, fluids to replenish their sweating and vomiting and diarrhea. Now, vector-borne diseases have been increasing, and this is indeed a public health concern. According to Jamaica's Minister of Health, Dr. Fenton Ferguson, the factors such as urbanization, population growth, and increased global trade and climate change have been making our region susceptible to these outbreaks. In conclusion, ZikV is considered an emerging pathogen with potential to cause widespread illness. This requires collaboration between clinicians, and public health officials to ensure adequate surveillance, prevention, and protection of our region. I thank you.